Good afternoon. I welcome you all to the 2954th lecture of Bangalore Science Forum, so also an IQAC initiative. I welcome our Honorable Secretary of National Education Society, Shri Venkata Shivareddy, to the event. It's my pleasure to welcome today's guest speaker, Dr. Ram Prasad Ramalingam, who is a senior nephrologist. Also, a hearty welcome to the other speaker, Dr. Nagarjuna Reddy, who is a urologist. I welcome Dr. Ramesh, principal of the institution, and I also welcome Professor Alkananda, IQAC coordinator, and Srimati Pratima, Secretary, Bangalore Social Science Forum. Thank you.
First one. May I request Dr. Ram Prasad Ramalingam sir, kindly come to this. Dr. Ram Prasad Ramalingam is a senior nephrologist with over 23 years of experience. He specializes in kidney care, including renal biopsy, dialysis therapies, kidney transplantation. Trained at premier institution in Tamil Nadu, he has 11 years of clinical and 5 years of teaching experience. He is skilled in nephrology procedures and known for his compassionate patient care. So today we welcome you to this Science Forum lecture. Thank you. Dr. Nagarjuna Reddy Danduri, he is an experienced urologist with over 9 years of expertise in treating the urinary tract infection, kidney stones, prostate condition, urine flow issues, and gland tumors also. He specializes in laparoscopy and endourological procedures, including laser, lithroscopy, and surgeries for bladder cancer and varicose. Sir, on behalf of Science Forum and the National College, we welcome you to this forum, sir.
Good evening, everyone. First of all, I thank Bangalore Scientific Forum for inviting us to give this talk. Nephrology and urology both deals with kidney. Urology, to be said simply, whenever there is a block in passage due to stone or tumor or infection related, the urologist will do surgical intervention. Whenever there is kidney dysfunction is there, when there is medical treatment is required, we nephrologists will intervene. So my talk will consist about the kidney function and common kidney diseases and how to diagnose it, how to treat it, and how to prevent it. Those things I will be dealing with. Kidney is a paired organ. So when some of our organs are paired, we are gifted to have two kidneys. One kidney, if for any reason is not functioning, the other kidney will overtake the function and it will compensate it. This is many people, very rarely you can see people will born with one kidneys. We call it as renal agenesis. They can live a normal life. This gives us opportunity to do transplantation. We take one kidney from a healthy person, relative person, and that kidney can be given to his relative who is suffering from end-stage kidney disease. Kidney is an organ which weighs around 150 gram and length is 9 centimeter. Whenever chronic kidney disease sets in, the size will start shrinking. It will go less than 8 centimeter. The function will come down. The size of the kidney is an important indicator for the long-term kidney function. This is the picture showing where is our kidney. You can see the kidney is situated in the abdomen. One is on the right side, one is on the left side. It is in the upper part of the abdomen behind. You can see the ureter coming from both the kidneys and joining in the bladder. From bladder, through urethra we pass urine. You can see that bean-shaped kidney, and you can see blood vessels coming inside and going outside, and ureter, which is coming down. And kidney has a capsule. Inside that, if you go, there is a thin part upper, you can see that is cortex. Inside is medulla, where nephrons are situated. Each kidney has got 1 million nephrons. These nephrons will separate urine from the blood, and that urine come to the pelvis, and pelvis is the region where you can see the conical portion. That is called pelvis. There urine will get collected, and then it comes down in the ureter. Kidney has many functions. Its important function is excretion. It excretes the waste products from the blood, and water balance is maintained by the kidney. It also maintains the salt content, sodium, potassium. These are all have narrow limits. If you cross that narrow limits, even if it is higher or lower, can result in life-threatening complications. So kidney does major work on this. And acid-base balance. Our body produces 1 milliequivalent per kg acid or per kg acid per day. So that has to be excreted by the kidney. Another important function of the kidney is control of blood pressure. If blood pressure control is not there, kidney will get affected. Same way, when there is a kidney problem, blood pressure will goes up. So it is a vicious cycle. And kidney is an important organ which secretes a hormone called erythropoietin, which is very important for the blood production. And those who are having chronic kidney disease will have anemia because of decreased blood production. Kidney is also important in bone strength. We all know calcium is an important element in the bone that is closely monitored by the vitamin D metabolism. This vitamin D is activated by the kidney. Without kidney, the vitamin D is not activated, so bone strength will go down. In chronic kidney disease, chronic means long-term kidney disease. Long-term kidney diseases many times will be asymptomatic. Unless we do testing, we cannot come to know. Only at the stage 5, the kidney, when goes for end-stage renal disease, the patient will start having symptoms. But in acute kidney injury, which is a short-term kidney problem, usually symptoms will arise immediately. Patient cannot tolerate the waste product increase in the blood. These are some symptoms of the kidney diseases. Swelling, it is a very important symptom. There will be swelling in the face and swelling in the legs, and other organs also may get swollen because of the fluid retention. Red urine is passed when there is stone, infection, or tumor. Frothy urine is passed when there is a protein leak. There are situations, most of the time kidney function will present with reduced renal function. Certain diseases like diabetes insipidus, it is not diabetes mellitus, it is diabetes insipidus. That condition, there will be a lot of urine will be produced. That also a abnormality in the kidney. And loin pain, abdominal pain can happen when there is infection and stone formation. Patient can have extreme tiredness in the advanced kidney disease, breathlessness when they have blood or water accumulation in the body, When cardiac cope up with that fluid is not happening, the fluid will get accumulated in the lungs. Patient will present with acute pulmonary edema, where desaturation occurs and patient condition is life-threatening. Nausea, vomiting happens mainly because the waste products are affecting the brain. And bone pains because, as I already told you, when the bone strength weakens, goes for weakness, then the patient will start having renal osteodystrophy and bone pain. In children, when they develop kidney disease, their growth is impaired. This is one of the common conditions we come across in children. It is due to protein leak. Because of the protein leak, the blood viscosity and colloid osmotic pressure will go down. The fluid will start seeping into the interstitial space. So when the child wakes up like this with periorbital edema. And by evening, the child will develop leg swelling. And when there is a glomerulonephritis, there is an inflammatory condition where the urine will become red because of the blood component in it. And this kind of bleeding, when occurs from kidney, usually it won't clot. But in the urinary tract, if there's a bleeding lower than kidney, the clots will happen. The important cause for kidney failure is diabetes mellitus and hypertension. These two diseases cause 50% of the kidney diseases. If you see dialysis patients, among dialysis patients, 50% will be affected by diabetic nephropathy. And hypertension, 1 in 5 patients of hypertension will develop a kidney failure. Block of passage due to tumor, stone, infection-related materials can cause renal failure. Inflammatory diseases, a big list is there, including autoimmune diseases, can cause kidney failure. Drugs, this is one of the avoidable cause for kidney failure. We should have awareness, we should avoid painkillers and alternative medicines. These are all not good for kidney. And hereditary, certain conditions like cystic kidney diseases and Alport syndrome, like conditions where the kidney disease will be inherited. How to prevent kidney diseases? The first and most important is stop smoking. Smoking is an independent risk factor for kidney disease. It will cause kidney disease, it will progress the kidney disease, and bladder cancers, kidney cancers occurs in smokers. Good control of blood sugar is very important, and good control of blood pressure is very important to prevent kidney disease from appearance as well as progression. Early detection of screening is very important. So don't get scared of detected of diabetes and hypertension in early age. So detecting early, it will prevent, preventive measures can be taken early so that kidney function can be protected, and we can avoid kidney getting into end-stage kidney disease. And lifestyle modifications and drug usage to be appropriate and avoid unnecessary medications. When kidney problem is there, 3 things are very useful for identifying the kidney problems in the early stage. One is urine analysis. It's a simple test, but we can get a lot of information about the kidney problem. And serum creatinine, it is the marker for kidney function. Whenever kidney function comes down, creatinine will start rising. Creatinine is produced basically from the muscle and excreted in the urine. When the kidney function start coming down, creatinine will start going up. So eGFR, that is estimated glomerular filtration rate, will start coming down. Blood pressure monitoring is very, very important. It gives clue. Whenever you detect a patient with blood pressure, hypertension, they should be screened for the kidney disease. Whatever the age, whether they are young or old, they should be checked for kidney function. There are non-invasive tests to identify kidney problems. This is one is ultrasound. Ultrasound, we can see the obstructed system that will be dealt with our urologist. You will talk about it in detail. And this is also a radiological imaging where we use contrast to identify kidney problems. And this is a renogram where we can see the shape of the kidney, scars can be identified, and kidney function can be measured. And one more invasive important test is renal biopsy. That we will do it whenever is necessary. Whenever acute renal failure comes, when we are uncertain about the cause, we get it done. We cannot do, the small contracted kidneys cannot be biopsied, but normal size kidneys can be biopsied, and it gives the cause for the kidney failure and why it is, how long it is, and what measures we have to take to prevent further progression. All three these informations we get it from renal biopsy. Renal biopsy is a bedside procedure and daycare procedure. And in 2016, we conducted one screening during a World Kidney Day. 224 were screened. Among them, 10% had diabetes, 10% had hypertension, 10% had renal failure. So this is important data. So we can see how community prevention of kidney disease is possible by doing these kind of screenings. And even we suggest central government and state government to focus on community health care so that prevention of kidney disease is more cost effective and economical than treating the end-stage kidney diseases with dialysis and transplant. So certain preventive measures, healthy lifestyle prevents many diseases, diabetes, hypertension, cardiac disease, and kidney disease. Salt is a major enemy. Nowadays, if you see in all commercial restaurants and junk foods, the salt level is going up year by year. They are making us addicted to the food by increasing the salt level. So we should be aware of that. We should consume less salt that is healthy for our kidneys and heart. And fruits and vegetables. Fruits and vegetables to be consumed all 3 meals. It is not one meal. Always remember all 3 meals if you consume fruits, vegetables, that will prevent kidney obesity, heart disease, and kidney disease. If you take 1 plate of food, half of the plate should have fruits and vegetables. Remaining half only should have carbs and protein. And physical activity. Sedentary life will bring a lot of issues, health issues. So swimming, jogging, cycling, walking, all those things will help you to have a healthy life. Stress busters like music, dancing, yoga, meditation, all will help you to control your blood pressure, and it also helps in organ damage. So knowing the body gives us the confidence to move on. And if there is a disease, then better it is found early to treat it. Don't get scared of diagnosed of diabetes. Whenever you have family history of diabetes and hypertension, in young age itself you get screened for it. And understand your disease, its complication. Once you know about the disease, if you Google it, it's no harm. But without knowing the disease, don't Google. Then get into unnecessary stress. And understand your disease and its complication. Visit the necessary doctors. Always it's good to have one physician, family physician. That is going on now. Nowadays, whatever problem, we are going to specialist directly. That should not happen. All of you should have family physician. Go to the family physician. He will direct you to the right specialist whenever is required. And he will know the whole body and your history about your family, everything in detail. So follow proper diet and exercise schedule. One more thing I want to emphasize, in academic, we are all in academic career, so we used to spend a lot of time in computers nowadays. So low back pain is one of the major causes of taking the painkillers. So certain tips I will give so that you can avoid this back pain and taking painkillers. These pictures itself will show certain the way how should we maintain our posture. So good posture is straight posture is this one, and while sitting this is the correct posture. So arm rest also should be in the right appropriate height. It should not be high, it should not be low. And back support, nowadays ergonomics chairs are available, please go with that. And the knee and the height of the seat should be in this way that a 90-degree angle is found between the thighs and legs. And always make sure your foot is placed in the flat manner on the ground floor. And and also the monitor should be kept in a appropriate height and distance. And don't forget to move around every 20 minutes. When you are working on the computer, every 20 minutes take a break and move around. Thank you.
A very good evening to all of you. Thank you for the National College BASAVANAGUDI, Bangalore Science Forum and Social Science Forum for giving me the opportunity to speak here. I am Dr. Nagarjun Reddy, consultant urologist at NU Hospital. I am going to take you on common urological diseases that we experience in our OPD commonly. Before going to the topic, I just want to make sure that you all know certain basic differences in the anatomy between male and female. You can see on the right side image is the female and the left side is the male. So the kidneys right and left, the ureters right and left, and bladder is common for male and female. The urethra is the tube which carries urine from the bladder to outside. That is only around 4 centimeter in female, and it is around 18 to 20 centimeter in male. That is one difference. And in male, you can see just below the bladder, there is one bubble-like structure, which is a prostate. That won't be there in a female. These are the basic differences between male and female. So these are the three common urological problems that I'm going to speak on today. That is, one is kidney stones, one is urinary tract infections. Then if time permits, I speak on enlarged prostate. What are kidney stones? Kidney stone is actually a misnomer. It is urinary stones. They can form anywhere in the kidney or ureter or the bladder, sometimes in the urethra also. So what are the risk factors for forming a kidney stones? The first most is dehydration. So taking less water per day, taking long breaks between water intakes, and second is diet, taking more animal protein, taking high salt and sugar. There is a genetic risk also where the family members are having stones, that you are little at a higher risk to develop the stone. Obesity is again a risk factor. History of urinary tract infections can be a risk factor for stone. Hyperparathyroidism. Thyroid, everybody will know thyroid. There is behind the thyroid, there is parathyroid glands are there. If they are overworking also, patient can develop a stone. Excessive supplement intake can also cause stones like vitamin D, calcium, vitamin C, and protein supplements in excess. So without a prescription, without a doctor supervision, can cause kidney stones. There are some bariatric surgeries like gastrointestinal bypass. Major bypass surgeries can cause kidney stones. Those who are suffering with gout, that is more uric acid levels in the blood, they are at high risk for stones. There are some inherited metabolic disorders which are prone to stone formation. So when a patient is having a stone, what are the symptoms that we can expect? So not all patients with the stones may not need to have symptoms. So majority of the stones are asymptomatic. Majority of the stones which are small and lying in the kidney, they don't give any symptoms until they grow bigger in size or when they drop into the ureters, that is the urine tubes. So when the stone drops into the ureter, so patient may experience very severe pain in the abdomen, especially on the lateral part of the abdomen, that is flank. Along with that, patient may get vomiting, nausea, vomiting sensation. So other rare symptoms can be pain while passing urine, fever with chills, that is shivering, inability to pass urine, or feeling the urge to pass urine, but when they go to toilet, they may not urinate. So sometimes you can notice blood in urine and cloudy color urine, foul smelling urine as well. So when you go with these symptoms, what doctor advise you? What test you may expect to do it? The basic test that we need to do is a urine analysis and one ultrasound scan. Suppose if ultrasound scan is not giving enough information, then only we go for a CT scan. So what are the treatment options that are available for treating a kidney stone? Not all stones require treatment, absolutely no. So majority of the stones not require treatment, they need a follow-up and observation. Stones which are in the kidney and less than 10 millimeter in size may not require treatment. So because there is high likely that they can pass through the natural urine passage when they are small, less than 10 millimeter in size. So when they drop down into the ureter and they are small, still we can treat with medicines. Up to 10 mm size, we can treat with medicines. So only stones which require surgery are very large stones in the kidney, that is more than 1 centimeter size in the kidney, very large stones blocking the ureters, that the urine passage blockage, and stones lying in the bladder require surgical intervention. Surgery is also, again, there are different modalities. Science has advanced. There is very minimal invasive approaches now. So 90% of the treatment don't require any cut through the skin. Majority of them can be managed through the natural orifices with endoscopy and laser. So how to prevent stone? So one important thing is to get hydrated adequately. What is the level of hydration? Some may advise you to take 5 liters, 6 liters. No, not so. So the ideal fluid intake should be enough to produce 2 to 2.5 liter urine. So you may have to drink around 2 to 2.5 liter water, and food also gives you around the natural water source of around 1 liter. So take all kinds of fruit juices, especially citrus containing fruits like oranges may help. And a diet rich in vegetable and fruit fibers will give you chances of stone formation risk is less. So shift from animal protein to plant-based protein. Animal protein still you can consume once or twice in a week in small quantities. So especially red meat is at high risk from stone formation, and maintaining a body mass index at a good range around 20 to 22 is important. And salt intake, you have to reduce it by 50%. The daily recommended dose is 5 grams on an average, but when you are at a risk for stone formation or you are already having a stone, then it has to be reduced by 50%. Calcium, milk and milk products you can safely continue to take. There are some people who will stop consuming all milk products not required. So other is regular exercises and maintaining a healthy body mass. So the next one I'm going to speak on urinary tract infection. So what is urinary tract infection? Urinary tract infection is inflammation caused by bacteria or fungi in the kidneys or ureter and the bladder. Most of the time it is common in the bladder or urethra, and it is more common in female for the reason I mentioned earlier. The urethra in female is very shorter. For the bacteria to enter into bladder is easy in a female. So not everybody will get urinary infections. Why? Because we have some natural defenses for urinary infection. The urine itself is a good natural defense mechanism for urinary infection. When you are maintaining adequate amount of urine output in good quantity and good acidity and osmolality, that itself is a natural protective for UTI. So the mechanical flushing of the urine itself again flush out the bacteria. There are other innate immunity like body immunity will take care of it. There are linings in the bladder which prevent bacteria to encroach the bladder. So when there is a break in these mechanisms, then one person may get urinary infection. So what causes UTI? One is personal hygiene. Maintaining very unhealthy perineal hygiene is one thing. Not drinking enough fluids again. Holding of urine for long periods is the most common reason identified, especially in the female when they are traveling. They are hesitant to use public toilets. They think that public toilet uses may cause UTI, but it is otherwise. If you hold bladder instead of using public toilet, that causes urinary infection. That's why most of the patients, when they travel to some place and come back, they'll catch up urine infection, they'll visit us. So don't hold your urinary bladder. And catheterization, when some patients are admitted to hospital, when catheter is required, that carries little bit of infection risk. Menopause, when in male it is andropause, in female it is menopause. When estrogen levels goes down, in male when testosterone levels goes down, the body immunity and natural defenses, there is a breach, then they can catch easy infections that age group. Sexual activity, especially unhygienic, unnatural sexual activities carries urinary infections. What symptoms we expect when there is urinary infection? One is frequent urination. Second is pain while passing urination, burning sensation, cloudy urine or blood in urine, lower abdominal pain, pain in the abdomen below the belly button. So pelvic pain, especially in the female, the pelvic will pain. Fever, low grade to high grade fever with shivering may be there, especially when kidney is infected. Nausea and vomiting, especially when kidneys are infected. What test a doctor will do usually when you go with these symptoms? If doctor also thinks that this is urinary infection, then he may ask you to do one urine analysis test and urine culture. These are mandatory before treating urinary infection. Most of the time, if you go to a general clinic, they may ask you to take direct antibiotics. So better to avoid that way, because not always the burning urination is because of urinary infection. Majority of the time it is of other causes. So, but most of the clinicians, the burning urination is UTI, they'll directly give antibiotics. So that indirectly will increases the risk of UTI in further. So sometimes when there is a complicated urinary infections, doctor may ask you to get an ultrasound scan. What is the treatment? So not all patients with burning urination require treatment, because burning urination is not always UTI. So we have to differentiate between complicated urine infection and uncomplicated urine infection. So complicated urine infections, especially when they have associated other health issues like uncontrolled diabetes, they have associated kidney stone, they need to be treated aggressively and in a different manner. Uncomplicated UTI is simple UTI, that is patient will have only slight burning urination and lower abdominal pain, not even fever. That requires a simple 3 or 5 days course of antibiotics. Sometimes even they don't go for a hospital, still natural immunity will take care of it. So before treating, we should consider our local antibiogram. What kind of infections are common? What bacterial infections are common? What is the resistance to antibiotics in the local community? That we need to consider before giving an antibiotic. So once we get the culture report, we have to change the antibiotic to culture-specific antibiotic. And always the treatment should be complete. Suppose if a doctor advises you to take 5 days of medication, maybe second day your symptoms may relieve. You don't stop the medication. That causes incomplete treatment. Incomplete treatment causes resistance in the bacteria. Whatever bacteria then grow, they are very resistant to antibiotics. So preventive measures, I already explained, there are some natural defenses. If you maintain that natural defenses, those itself are the preventive measures. Adequate hydration, timely emptying of the bladder. So every 3 to 4 hours you need to empty your bladder, especially when you're traveling. Hydration, every 3-4 hours have 2 glasses of water. Don't need to sip every hour at the same time. Don't need to consume 4-5 liters. Actually the 30 to 40 ml of water per kg body weight per day is the ideal. So it ranges from 1.5 to 2.5, 3 liters according to your body weight. So can I speak on enlarged prostate? Yeah. So enlarged prostate. This prostate is an endocrine organ, male reproductive organ that is present only in the male below the bladder, around the urethra, that is the urinary tube. So it enlarges physiologically, naturally also it enlarges in a male when the age crosses 45 to 50 years. That is the age when andropause will occur, that is decrease in testosterone levels. That is the time when prostate grows bigger. But all prostates which are grown bigger, no need treatment or no need to cause symptoms. The risk factors for prostate enlargement are aging. So as the age advances, the risk is more. Genetics, when your parents are having enlarged prostate, you are little high risk to get an enlarged prostate. Diabetes, again, prone to enlarged prostate. Those who are having erectile dysfunction, erectile problems are more at risk to have an enlarged prostate. Obesity is another standalone cause for enlarged prostate. So what symptoms a prostate can cause? So the patient may feel urgency to urinate. They may wake up more frequently in the night. They may urinate every 1 hour in the daytime also. When they go to toilet, the urine may not come. They have to wait and strain. So when they start urinating, the flow may break in between. So when they complete urination, they may still feel that bladder is not emptying. So the force of urination might have come down. These are all the common symptoms they experience with this enlarged prostate. So what tests we need to do? So digital rectal examination, that is your urologist will put his finger into your rectum and he'll examine the prostate. That itself will give 90% of the information on the prostate. Apart from that, we need to do one urine test to rule out infection, one flow study before starting medications. Again, to the treatment, not all patients with enlarged prostate require treatment. 70% of the patients with enlarged prostate does not require treatment, only certain lifestyle modifications are sufficient. So remaining 30% of the patients for whom the symptoms are bothering, that their sleep is disturbing because of the urination, or their travel is disturbing because of the urgency urination, so their work is getting disturbed, then only we'll start medications. So out of that 30 also 20% can be managed with medication. Only the remaining 10% of the people who are not improving on medications will require surgery. Again, nowadays the surgery is very advanced. We don't need to cut through the skin. There are endoscopic and laser surgeries available per prostate also. So for those who are not on treatment, the basic precautions to be taken is when there is an enlarged prostate, cut down on your water intake to 1.5 liter. So empty your bladder regularly. Don't hold bladder for long hours. If you hold your bladder for long hours, then it is become even difficult to empty your bladder, which stretches the bladder musculature and becomes weak. So avoid constipation. When there is a constipation, that is hard stool, your urinary problems will worsen. So these are what I explained to you. Along with that, maintain a healthy height, BMI, and quit smoking, moderate in exercise, timed voiding, fluid intake as moderate I told. So limit coffee and alcohol intake, especially in the evenings. So and restrict your fluid intake 1 or 2 hours before sleeping. So those who are having a prostate and taking medications, better to restrict fluid intake after 6 p.m. in the evening. Thank you very much for all of you for giving this opportunity. Any questions from the audience? I'm happy to take. regarding stone or urine infection or anything. Okay. Thank you so much.
Any questions related to urology, nephrology, you can ask. Doctors will answer. Or if you are hesitation to ask any questions here, you can ask outside the auditorium also.
I have a question.
Yes.
When women have urinary tract infection, and I think what you said and what I believe also that it's not from outside, it's internally only, and especially menopausal women with the lack estrogen levels, so they get it. I just want, is it true? So not from the dirty toilets? Or,
Yes. So it's an important question. Basically, during menopause, that is around 45 to 50 years in the female group, the estrogen comes down. There the vaginal becomes dry and atrophy. There is a breach of natural immunity, so the bacteria can easily enter in the system. So most of the time, the bacteria ascend from outside to inside. So when the immunity is very low, the natural bacteria within the body can also harmful. So usually the bacteria from the perineum, that is the motion area, so from there the bacteria can ascend. When the perineal hygiene is, personal hygiene is not good also, then also there is a growth of bacteria which can enter in the system. Yes.
one more question I have. So for a patient undergoing dialysis, is there any hope or it's end of it? Or is there any cutting edge?
Dialysis has improved the quality of life in end-stage renal disease. Earlier, 30 years before and all, when we are diagnosing end-stage disease, it is the end of the patients. It's like life sentence. But nowadays, people are doing well with even 10 years, 15 years in dialysis. But if you consider dialysis and transplant is the best option. So transplant gives them the quality of life and longevity of life. Definitely, transplant is having edge over the dialysis.
Thank you very much.
Sir, please throw light on the prostate cancer stage.
Prostate cancer.
So prostate enlargement can be physiological, as I said the last talk. The other enlargement can be cancerous, that is malignant. But you don't need to worry much about prostate cancer, because prostate cancer is one cancer which responds very well to treatment. So especially we'll evaluate or we'll screen for prostate cancer when there is a family history positive, when their parents or grandparents are already treated for prostate cancer, or when they have a severe urinary problems or blood in urine, we'll again screen for prostate cancer. So there is one blood test, PSA test. So that will give a little idea about whether the patient is likely to have a prostate cancer or not. If that is coming as positive, then we may do a biopsy and confirm it. So there is no specific risk factors for prostate cancer. So smoking is one risk factor, and like sedentary lifestyle is one risk factor. Apart from that, there is no identifiable causes which can cause prostate cancer. So usually it is the cancer of very old age. Like if I take 10 random people at the age of 90, at least 3 or 4 will have prostate cancer. It is a natural process. So even if they are diagnosed with prostate cancer, there is cure is there nowadays. It can be completely cured. So there is no preventive things except cessation of smoking and healthy lifestyle.
Thank you, sir.
Thank you, sir.
So one more thing, can CKD be cured only by taking tablets?
CKD has got 5 stages. From stage 1 to stage 4 is medical management. Once it goes to stage 5, patient will start having symptoms. And also the biochemical parameters will get abnormal, which cannot be treated by medical therapy. At that stage, we start dialysis.
Thank you, sir.
Sir, one more doubt. Can you explain regarding hydronephrosis? Yes.
So hydronephrosis is a condition when the ureter, that is the urine tube which carries urine from the kidney to the bladder, when it is enlarged, distended and stored urine, that is called hydronephrosis. That can be because of multiple reasons. Based on the age group, there are so many other reasons. Usually in younger ages, most of the time stones will drop down and block the urine tubes, that causes hydronephrosis. And in elderly patients, especially in males, the prostate is enlarged and they are not able to empty the bladder because of the back pressure changes. Again, hydronephrosis can happen. So there are so many other reasons, even from simple infection, stone to cancer. There are so many reasons for hydronephrosis. When hydronephrosis is reported in ultrasound scan, we need to evaluate it. It is curable based on the cause. What causing hydronephrosis we have to see, and we have to treat that the thing which is causing hydronephrosis. It is curable. It is curable. When in long-standing hydronephrosis, even after treatment, residual hydronephrosis we'll call it, little bit of swelling will persist throughout the life, but that is harmless.
How can the initially the patient or those who are affected from that how can they know this is hydronephrosis?
So hydronephrosis, before that, they might have had a pain in the abdomen, pain in the kidney region, flank, urinary symptoms, urine infections. There might be some alarming symptoms which they might have neglected previously. Once hydronephrosis is formed, it gives pain. Over the time, your pain sensation will go off, will unnoticed. Sometimes patients will think that pain is because of gastritis and they have taken some medicines. Over the time, it is ignored. They'll come in a later stage where kidney is already damaged. So there is no symptoms of long-term hydronephrosis. It has to be diagnosed through an imaging, ultrasound or a CT scan. Yeah, thank you.
ಚಪ್ಪಾಳೆ ಹೊಡಿತಾ ಇದ್ದಾರೆ, ಗೊತ್ತಾಯಿತು ಬೇಗ ಮುಗಿಸಿ ಅಂತ ಹಿಂದ್ಗಡೆ. ಸೊ ಈ ಕೊನೆಯದಾಗಿ ನಾವು ವೋಟ್ ಆಫ್ ಥ್ಯಾಂಕ್ಸ್ಗೆ ಇಟ್ಕೊಂಡಿದ್ದೀವಿ. ಸೊ ಬೆಂಗಳೂರು ಸೈನ್ಸ್ ಫೋರಮ್ ಇಟ್ ವಾಸ್ ಸ್ಟಾರ್ಟೆಡ್ ಇನ್ ದ ಇಯರ್ 1962 ಆ್ಯಂಡ್ ಸೋಷಲ್ ಸೈನ್ಸ್ ಫೋರಮ್ ಇನ್ ದ ಇಯರ್ 1998. ಅಂದಿನಿಂದ ಇಂದಿನ ತನಕ ಈ ಕಾರ್ಯಕ್ರಮ ಮಾಡಿಕೊಂಡೇ ಬರ್ತಾಯಿದ್ದೀವಿ. ಸೊ ಸುಮಾರು 3000ಕ್ಕಿಂತ ಹೆಚ್ಚು ಟಾಕ್ಸ್ ಇದೇ ಪ್ಲ್ಯಾಟ್ಫಾರ್ಮಲ್ಲಿ ನಡೆದಿರ್ತಕ್ಕಂಥ ಒಂದು ದಾಖಲೆ ಇದೆ. ಎಲ್ಲ ಇಂಥ ಟಾಕೇ ಇರುತ್ತೆ. ಆ್ಯಕ್ಚುಲಿ ಬಿಲೀವ್ ಆರ್ ನಾಟು, ನಮ್ಮ ಬಾಡಿಯಲ್ಲಿ ವೈಟಲ್ ಆರ್ಗನ್ಸ್ ಇರ್ತಿರ್ತವೆ. ವೈಟಲ್ ಅಂದರೆ ಬದುಕಿರೋವು. ಅವು ಬದುಕಿರೋ ತನಕ ನಾವು ಬದುಕಿರ್ತೀವಿ, ಅವು ಸತ್ತು ಅಂದರೆ ನಾವು ಸಾಯ್ತೀವಿ ಅಂತ ಲೆಕ್ಕ ಇರೋದು. ಹಾಗಾಗಿ ಟು ಮೇಂಟೈನ್ ಆಲ್ ದಟ್ ವೈಟಲ್ ಆರ್ಗನ್ಸ್ ಇನ್ ಎ ಹೆಲ್ತಿ ಕಂಡೀಷನ್ ಯುವರ್ ಕಿಡ್ನಿ ಈಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಅದೇ ಡೈಲಿ ಕ್ಲೀನಿಂಗ್ ಮಾಡಿಕೊಂಡು ಶುದ್ಧತೆ ಮಾಡ್ತಾ ಇರುತ್ತೆ. ಅದ್ರ ಬಗ್ಗೆನೇ ಇವತ್ತು ಟಾಕ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ಸೊ ಬಿ ಕೇರ್ಫುಲ್ಲು. ನಮಗೆ ಗೊತ್ತಾಗಲ್ಲ ಈಗಿರ್ತಕ್ಕಂಥ ಲೈಫ್ ಸ್ಟೈಲಲ್ಲಿ ನೀವು ತಗೊತಾ ಇರ್ತಕ್ಕಂಥ ಆಹಾರ ಮತ್ತು ಡ್ರಿಂಕಿಂಗ್ ಆಫ್ ವಾಟರ್ ಇದೆ ನೋಡಿ. ಇತ್ತೀಚೆಗೆ ಒಂದು 3 days ಬ್ಯಾಕಲ್ಲೇ ಟೈಮ್ಸ್ ಆಫ್ ಇಂಡಿಯಾ ಫ್ರಂಟ್ ಪೇಜಲ್ಲಿ ಹಾಕಿದ್ದಾರೆ, ನಿಮ್ಮ ಮಿನರಲ್ ವಾಟರ್ ಬಗ್ಗೆನೇ ಬರೆದಿದ್ದಾರೆ. ಸುಪ್ರೀಂ ಕೋರ್ಟ್ ಅವ್ರು ಆರ್ಡ್ರೂ ಮಾಡಿದೆ, ಯುವರ್ RO ಫಿಲ್ಟರ್ ಈಸ್ ನಾಟ್ ಸೇಫ್ ಫಾರ್ ಯುವರ್ ಡ್ರಿಂಕಿಂಗ್ ಅಂತ. ಸೊ ಇಂಥ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ಇಂಥ ಒಂದು ಟಾಕ್ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥದ್ದು ಪಾಪ ನಿಮ್ಮ ಕ್ರಿಕೆಟ್ ಟೀಮ್ ಅವ್ರಿಗೆ ತುಂಬ ಅನುಕೂಲ ಆಗುತ್ತೆ ಇದು. ನಾಳೆಯಿಂದ ಕ್ರಿಕೆಟ್ ಟೀಮ್ ಆಡಬೇಕಾದ್ರೆ ಯು ಡ್ರಿಂಕ್ ವಾಟರ್, ಗುಡ್ ವಾಟರ್ ಆ್ಯಂಡ್ ಮೇಂಟೈನ್ ಯುವರ್ ಕಿಡ್ನಿ ಇನ್ ಎ ಗುಡ್ ಕಂಡೀಷನ್, ದೆನ್ ಯುವರ್ ಹೆಲ್ತ್ ವಿಲ್ ಬಿ ಗುಡ್. ಸೊ ಆನ್ ಬಿಹಾಫ್ ಆಫ್ So I thank the two speakers of today. One is Nagarjun Reddy. I think he is expert in urology. And I thank you, sir, on behalf of the management and all of us present here. And Ramprasad Ramalingam is a nephrology. Nephrology is a sub-branch of that urology. It comes under that kidney, inside the kidney. We don't know in coming days ಅಲ್ಲಿ ಇನ್ಯಾವಾಲಜಿ ಸೇರ್ಕೊಳ್ಳುತ್ತೋ ಗೊತ್ತಿಲ್ಲ. So ಹಾಗಾಗಿ we thank you, sir, for being the part of this and given good information. I thank you, Madam Suchari Chandra, Secretary of Bangalore Science Forum, and I thank Alkananda Madam, and I thank Pratima Madam, Secretary Bangalore Social Science Forum, Bangalore, and I thank all the students and faculty who are presenting for this wonderful session. ಆಮೇಲೆ ಪ್ರಕಾಶ್ ಹೇಳ್ತಾ ಇದ್ರು, ಸರ್ ಕ್ರಿಕೆಟ್ ಅವ್ರಿಗೆ ಟಾಕ್ ಬೇಕಾಗುತ್ತೆ, ನಾಳೆಯಿಂದ ಕ್ರಿಕೆಟ್ ಟೂರ್ನಮೆಂಟ್ ಇದೆ, ಹಾಗಾಗಿ ಕರ್ಕೊಂಬಂದು ಅವ್ರಿಗೂ ನಾವು ಟಾಕ್ ಮಾಡೋಣ ಅಂದ್ವಿ. ಸೊ ಅದಕ್ಕಾಗಿ ನಿಮಗೂ ತುಂಬ ಧನ್ಯವಾದಗಳು ಹೇಳ್ತಾ ಇದ್ದೀವಿ. ಎಲ್ಲರಿಗೂ ಮತ್ತೊಮ್ಮೆ ಧನ್ಯವಾದ ತಿಳಿಸ್ತಾ, ಆಮೇಲೆ ಇದಕ್ಕೆ ಕಾರಣಕರ್ತರಾಗಿರ್ತಕ್ಕಂಥ ರವಿ ನಮ್ಮ ಅಲ್ಯುಮಿನಿ ಅವರು, ಅದೇ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಆ್ಯಂಡ್ ದೇರ್ ಟೀಮ್ ಆಲ್ಸೋ ದೇ ಕೇಮ್, ಈ ಕೇಮ್ ಆ್ಯಂಡ್ ಅಪ್ರೋಚ್ಡ್ ಮೀ ಇನ್ 1 week ಬ್ಯಾಕ್. ಐ ಥ್ಯಾಂಕ್ ಯು ರವಿ. ಈಸ್ ಎ BA student. BA student working in hospital. Look at the area of work ಆ್ಯಂಡ್ ಏರಿಯಾ ಆಫ್ ಸ್ಟಡಿ ನೋಡ್ಕೊಳ್ಳಿ. ಅದಕ್ಕಾಗಿ ನೀವು ಅಷ್ಟೇ ಎಲ್ಲಿ ಬೇಕಾದರೂ ನೀವು ವರ್ಕ್ ಮಾಡ್ಬೋದು, ಎಲ್ಲೆಲ್ಲಿ ಸಲ್ತಿರೋ ಗೊತ್ತಿಲ್ಲ. ಸೊ ಐ ಥ್ಯಾಂಕ್ ಯು ಒನ್ಸ್ ಅಗೇನ್ ಆಲ್ ದಿ ಫ್ಯಾಕಲ್ಟಿ ಆ್ಯಂಡ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಫಾರ್ ಬೀಯಿಂಗ್ ದಿ ಪಾರ್ಟ್ ಆಫ್ ದಿಸ್ ಫಂಕ್ಷನ್. ಥ್ಯಾಂಕ್ ಯು ಒನ್ ಆ್ಯಂಡ್ ಆಲ್.